Hello, everyone. I'm Jonathan Calixto, and today is Tuesday, March 11th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. The Association of Black Gastroenterologists and Hepatologists and the leading nonprofit Colorectal Cancer Alliance have partnered up to help promote early detection and expand healthcare access for those in need in regards to colorectal cancer. Joining me now to speak more on their efforts is the co-founder of the Association of Black Gastroenterologists and Hepatologists, Dr. Ugo Iroku, along with Ayla Casey, an advocate with the Colorectal Cancer Alliance. Thank you both for joining me today.
My pleasure.
Thank you.
Yeah, now,
Happy
of
to be
course,
here.
we have a very important topic that we are talking about today. And I want to start off by learning a little bit more about these organizations that you both are a part of. Now, Dr. Iroku, please tell me a little bit about the Association of Black Gastroenterologists and Hepatologists and the mission and the work that you do.
Well, I think we can all remember 2020 and the social cauldron it was with the death of George Floyd and that question as to whether or not Black lives mattered. And in that environment, we had an additional loss, of course, the loss of Chadwick Boseman from colorectal cancer at an early age. And as tragic as that story was, it is not uncommon. We know that Black people are 20% more likely to get colorectal cancer than their white counterparts and 40% more likely to die from it. And so a number of gastroenterologists across the country got together to form the Association of Black Gastroenterologists and Hepatologists to address this issue, to put the issue of health equity in the Black community at the forefront, and to see what we could do to bring the numbers and rates of colorectal down as low as possible.
Wow. Thank you so much for sharing more, just a little bit about the organization, of course. And I know we're going to talk a little bit more about the impact and obviously the work that is going into it now. But you are partnering with CCA. Ayla, can you tell me a little bit more about the mission behind the organization as well?
Of course, the Colorectal Cancer Alliance is dedicated to ending colorectal cancer through prevention, care, and research.
Yeah, now, of course, with this month, there is a mission for James, and it includes educational workshops. It includes a fundraiser, even at that. Ayla, can you talk to me a little bit more about this mission and this campaign specifically?
Absolutely. My late husband, James, was diagnosed with colorectal cancer at age 38, which is, 7 full years before the current recommended screening age for colorectal cancer. And he was very generous with his story and sharing it with the public because he wanted to empower everybody to be able to take charge of their health. So the key points behind this campaign are knowledge and access. And so we partnered with the Colorectal Cancer Alliance and ABGH to make this as easy as possible, bringing forth resources and raising money to provide screening services to those who are uninsured.
Yeah, you talk about the importance of bringing these resources, especially to communities. Talk to me about the impact. What do you hope that impact will be for individuals and their communities as well?
For the most part, I just really hope that people will have an awareness about this disease, that it is impacting young people at increasing rates year over year, and that this disease is treatable and preventable when it's caught early. It doesn't have to. It doesn't have to have the worst outcome attached to it. And if you know about it, and you know that you can assess your risk factors, whether that be family history or something else, then you'll know that you can get screened and potentially that be life-saving advice for you.
Yeah, now, of course, this month also marks National Colorectal Cancer Awareness Month. Dr. Iroku, talk to me about the importance of creating this partnership with this campaign, but also the work that you're doing as well.
Yeah, so we're a nation that lives in seasons, and we kind of codify the importance we put to issues. And of course, we're just coming off of Black History Month and speaking to the importance of that. And for in this month, March, in our field, we recognize it as a moment where we can speak to patients in the broader broader community about the importance of colorectal cancer screening. And that word screening is important because screening means you feel fine. You don't feel like you're ill. You don't feel like you're sick, but you might have a disease that's just beginning to form. And with screening, with our tests and the tests that we do in the community, we're able to find disease early on so that we can treat it. Like Ayla said, when we find colorectal cancer early, there's so much we can do for it. Even if it's full-blown cancer, it has a 90% cure rate. But if we wait and it becomes stage 4 cancer, then that cure rate drops down to around 15%. So even if it's cancer, finding it early matters. Colorectal cancer is definitely preventable and it's treatable and it's beatable. And we want to get that message across to the community.
Yeah. Now, doctor, with that, I mean, you put a big emphasis on screening, which is very important to being detected and to figuring out methods to obviously cope with what you are dealing with in your diagnosis. Where can people go to get screened and find out what risk factors they may be having?
Exactly. So, an easy start is always to go to your primary care doctor. That's always going to be to a person that you can go and say, "Hey, am I at the age where I'm supposed to be getting screening?" And we believe in screening for everything, whether it's your mammograms or your PSAs or your prostate and colorectal cancer. We definitely have a holistic approach. And so, having that conversation with your doctor is always going to be a big start. But luckily, there are amazing organizations, yes, like ABGH. You can get our website at blackandgastro.org and also the Colorectal Cancer Alliance. You can go to their website and they'll be able to get you to screening sources in your neighborhood. As much as we talk sometimes as gastroenterologists about doing colonoscopies or we look through the colon to see if there's any early polyp, there are other ways you can get screened as well. There's stool tests you can do. You don't even have to come in to get any anesthesia, but you can still get screened for colorectal cancer. And so luckily there are amazing amount of resources you can have to get your colorectal cancer screening where you are locally. It's something that can be done today.
Now, Ayla, going back to you, I know you obviously speak to how this has hit close to home. What do you see from your own journey that you went through as barriers that people do face when it comes to either screening, detection, or even healthcare access?
I think particularly with young people, symptoms are often overlooked. It's easy to chalk something up to just sort of being under stress or just some sort of normal life occurrence. And there are some symptoms that really should be looked at as this should never be looked at as a normal life occurrence, and you should speak to your doctor if this ever happens. So I think that that's part of it, but the other part of it is the getting to the doctor part. There's a lot of complexities when it comes to health insurance and going to the doctor, and this disease has traditionally been viewed as a disease that afflicts older people. And so oftentimes people will encounter at the doctor, and I know this is true with my husband James, that the first couple of doctor visits we were sort of told that sort of pushed off that this wasn't as serious as it was. So oftentimes that can also be an issue with young people at the doctor where, it can be overlooked as something else or misdiagnosed.
Yeah. Now, with that as well, Ayla, you are taking obviously what you went through, but you're also creating more resources and opportunities for a community. There is a webinar happening tonight at 8 p.m. Can you talk to me a little bit about what people can expect as they tune in to that?
Absolutely. We have doctors from ABGH that will be talking about what you can look out for, how you can be your own advocate, especially as a young person. But I can't emphasize enough that this information, these symptoms, they apply to all generations. So this webinar will be informative, it will be supportive, and we encourage everybody to come and tell someone they love to come. Self-advocacy is self-care.
Now, Dr. Iroku, Ayla was mentioning it, and you mentioned it earlier as well, how this disease is affecting different generations. It's no longer something that historically was for people over 50 years old. Even in 2023, the American Cancer Society put out a report that mentioned that 13% of new cases were diagnosed for people under age 50. Talk to me about what is this change, what is happening, any more information that you can share about that.
Yeah, and so it's very interesting that a lot of what our viewers might have heard years ago no longer applies. There was a time, even in medical school, where we were taught that colorectal cancer disease was a disease of older people. And I put that older in quotes respectfully. But we were finding that the trend has changed. And unfortunately, since the 1990s, with the advent of colorectal cancer screening, the overall rates of colorectal cancer are going down. But for the younger crowd who aren't getting screened, their rates are going up. And unfortunately, it's going up on the tune of about 1 to 3% every single year. And so now we have about, like you said, a fair fraction of patients who have colorectal cancer are actually young, under the age of 55, under the age of 50, under the age of 45. And so it's no longer enough to just say that a little blood in the stool is just from a hemorrhoid, or you're feeling fatigue, it's just from you working hard. It's okay to try to manage some of those symptoms at home, but you have to realize that that might be part of a greater trend where there's some health issues that are occurring in younger patients more so than ever before. And another important point is whether or not it's colorectal cancer or another gut disease, there's celiac disease, there's Crohn's. You don't have to be both the doctor and the patient. If you have some symptoms, if they haven't resolved, at some point it's time to come to the doctor and have a conversation about what might be going on.
Yeah, thank you so much for that advice, doctor. Now, Ayla, when we talk about these initiatives, these resources, these even opportunities for communities to come together, what do you hope people will take away from this month-long effort?
You know, a lot of times this type of effort is you can't necessarily directly measure the impact, but what I'm hoping for is that we're planting seeds that will germinate at a time when somebody needs the information. You know, I hope that if at some point a person or their loved one is going through something, that they'll remember this message that we are sharing and emphasizing throughout the month.
Definitely. And I mean, I think part of continuing that message and the importance of this topic is having these conversations. So thank you so much again, Ayla and Dr. Iroku, for being with us here today.
Our pleasure.
Thank you so much.
Now, for our viewers, if you want to learn more about colorectal cancer risk factors, please visit the website getscreen.org. Don't go away. We'll be back with more Open after this.